Well, thanks for joining us today. My name is Randy Van Straten, VP of Business Health here at Emplify Health. Happy to put together a program for you today. Basically want to talk about musculoskeletal treatment, and musculoskeletal conditions are one of the biggest health issues that we hear about when we work with employers. It's also one of the biggest healthcare cost drivers right now, and it's one of the fastest growing. So today we're going to talk about a treatment option that many of you have actually been asking about. And that's why we put this together. It's called Orthobiologics, or specifically called platelet-rich plasma. We're going to call it a PRP. But really, instead of taking this from a marketing perspective, we really wanted to talk about how this fits into an overall orthopedic care plan. When does this make sense, and when it doesn't, and how it can be used really appropriately in a broader treatment pathway. So I'm going to moderate this today, and I'm joined by two colleagues. Joe, if you want to introduce yourself first.
Sure. Good afternoon, everybody. My name is Joe Kucksdorf. I'm a physical therapist. I've been with Emplify Health by Bellin for about 16 years, and I am in a managerial role, and I help in our sports medicine and orthopedic service line oversee quality and professional development.
Thanks, Joe. And Dr. Berns.
Yep. So Ryan Berns here, primary care sports medicine doc here at Emplify Health. I've been here for 3 going on 4 years, and I kind of transitioned into my full role when Dr. Eben retired. So many of you might know him or know the name, but he is kind of was our primary care sports medicine doc. And when I joined the team, we kind of took a hard look at what we were doing well, and kind of how to grow the practice and grow the program. And one of those ways was actually some of the PRP offerings we're going to talk about today. They were kind of already doing it, but we really wanted to kind of grow it and do it the right way. So that's kind of part of the goal today, is kind of give you a little bit more information about some of that.
Great. Thank you, Dr. Berns. So Joel, let's start with you. When we talk with employers about healthcare challenges, musculoskeletal care, like I mentioned, it comes up right away. What are you seeing in the clinic? What are you experiencing?
Musculoskeletal issues are very common, and they're very common in working populations. We're seeing employees develop knee pain, shoulder pain, back problems pretty consistently. And have these problems from just exercising or sports activity, sometimes from work or repetitive work activity, and other times just from simply living life. And from an employer perspective, we know these conditions are really expensive. They drive medical claims, they can drive missed work days, and reduce productivity.
And I know from working with many of our employer partners and our insurance consultants, really trying to figure out how to get employees the right care early, right, before problems become more serious.
Exactly. Ideally, what we're able to do is get early intervention and appropriate care. It can make a big difference in both and the overall healthcare costs, hopefully helping in both areas.
Yeah. And one thing really is we often hear is that treatment can escalate pretty quickly in this path. So let's turn to Dr. Berns. Is this something you see clinically as well?
Yeah, can I stop you for a second? Do we have slides we wanted to share?
Oh, you know what? That is on me.
I was going to say,
forgot to share the slides.
Yeah, I'm happy to jump in unless there's anything you want to kind of recap. But yeah, I think, certainly when you're talking about how, like when we're thinking about, this kind of continuum of care, a lot of times people get plugged in to the clinical settings. They're having pain, no matter how long it's been, things that they're trying to work through. But then, like we were talking about, sometimes they end up with the imaging, like an MRI, and, people think there's, a tear or a partial tear. And, the question for a lot of people becomes, does it need surgery? And, quite frankly, sometimes it does. So sometimes surgery is the right option for a patient, but a lot of times, we think there's a lot of non-operative things we can do. So injections, formal therapy, Pete comes into play for some of these patients, but really truly, it's about getting the patient the right treatment at the right time, and for the right reasons. Every injury is a little bit nuanced and different. So again, yeah, the reality is, a lot of times we see people with the imaging and we're talking about surgery or surgical options, but there's many options even before that.
Mm-hmm. Exactly. So here we go. Instead of thinking about orthopedic care as either therapy or surgery, it's really more of a spectrum then, from what Dr. Berns was saying, right, Joe?
Yeah, Dr. Berns said it really well. Ultimately, there's multiple different options for our patients. The idea is try to get people to the right care at the right time. On the far end, on the left side, as a slide shows, self-care. There's a lot of people that, with a little bit of education and some time, they're going to get better. And then in the middle, we have, like Dr. Berns was saying, more of the conservative care, formal therapy or injections. We'll be talking more about orthobiologics or PRP. And then, yeah, sometimes surgery is necessary and actually the most cost-effective care as well. It just depends on the condition and the patient that comes in front of us.
Thanks, Joe. So, Dr. Berns, people have heard the terms like regenerative medicine or PRP, but they may not be familiar with the term orthobiologics. So, if you could kind of break that down for us. And the question is really, is that different than regenerative medicine that we hear on the radio?
Yeah, so I prefer to stay away from the term regenerative medicine. I think it's somewhat misleading. So with regenerative medicine, I think there's, maybe an understanding or a claim that, the injection or whatever the therapy is going to regenerate tissue. And I think, that hasn't really shown itself to be true in the literature or in our clinical studies. So again, I think it's somewhat misleading. The other term that a lot of people use is orthobiologics, and I think that's a little bit more appropriate or accurate there. So again, orthobiologics essentially means that it's a substance that we took from you, so a biological substance used to treat an orthopedic condition or indication. So I think it is probably the more appropriate term to use. And again, orthobiologics does encompass a broad range of substances or things that can be injected. But again, for our purposes today, we're going to kind of stick to PRP. There's stem cells, there's other things that are being developed. But again, I think the literature is farther along with PRP, which is why we're kind of talking about it and focusing on it today. Again, just kind of a broad overview. PRP is, again, that blood product we take, we really concentrate the platelet level, and then that is what gets injected back into the affected area or tissue here.
So then, can you just kind of expand upon what role platelets play then in the treatment specifically, Dr. Berns?
Sure. Yeah, so kind of like we were mentioning, so essentially, PRP injection. So again, just an overview. Blood is drawn out, gets centrifuged down, we get the platelet portion, and that's what gets injected back. Oftentimes what I tell people about the PRP or the platelets in particular is, so for example, if you get a kind of small cut on your arm, the first cells that are actually kind of drawn to the area are platelets. And they do a few things. So they try to stop the bleeding, and then they try and recruit kind of a good natural healing response. So really that's the goal when we do the PRP injection as well. So we're trying to stimulate some type of response. And overall, again, the slide here says we want to reduce the inflammation, but for a short period of time, we probably are increasing or inducing an inflammatory or healing process. And then the goal there is to improve the pain, whether it's from a tendonitis, kind of an overuse condition, a ligamentous sprain or an injury, or arthritis. So again, those are probably the most common indications. But again, the goal is to improve the pain and improve function, hopefully for the short and the long term.
That's a good summary there. I had a friend that I ran with for 35 years, and about 3-4 months ago, he couldn't run anymore because of having pain in his knees. in his one knee, and he wasn't running, and he went through this process, and he's actually back running again with our running groups. So it was great to see. So moving along here, let's talk about the current research that support using PRP.
Yeah, we kind of touched on it a little bit before. It is a growing kind of body of evidence and literature. But, coming out, now, I would say the most common indications or areas where we're really thinking about using this is, again, osteoarthritis. So if we're thinking kind of knee arthritis that we hear and see a lot about, there is some good literature there that it performs, as good or better than hyaluronic acid, especially over the long term. And then kind of tendonitis, we hear about the, tennis elbow or the lateral epicondylitis. So that, is a great, PRP is a really helpful injection to use there. And the way that I sometimes think about that one is, we used to use steroid for everything, right? So we would put steroid in the knee, we would put steroid in the lateral epicondyle for the tennis elbow. And again, while that can be helpful for improving some of the pain in the short term, I mean, it really truly is a Band-Aid. So it's not necessarily fixing anything or improving the tendon health or the knee joint health, again, going forward. So that's where PRP sometimes comes into play. And it's kind of better for the tissues long term. And those are probably the two most common areas that we talk about it. Again, it can be used for really any chronic tendinopathy or tendonitis. Ligament injuries, again, are there's a growing body of evidence there. And every joint for arthritis, we've used it for hand arthritis, hip and shoulder arthritis, but the best literature so far, the best evidence is for that knee arthritis or there's kind of chronic tendonitis like that tennis elbow.
Mm-hmm. So really, it's not appropriate for every condition then.
Yeah, we are learning more. So, right, truly, like every journal article I get, there's kind of some growing literature or evidence. And, but you're right. I mean, it's not appropriate for every single condition. So there's some nuance to that, right? So it really kind of just underscores why, getting the diagnosis right, selecting the right patient for that right treatment is important. Certainly some of the indications that I think where it can be somewhat less helpful, really truly like very advanced osteoarthritis, sometimes they're looking in the face of a knee replacement, and that can be the right treatment, or even the hyaluronic acid. So some of those more advanced arthritis, truly in the literature, PRP doesn't perform as well. And then there's tendonitis, like Achilles tendonitis. It certainly can be helpful for certain patients, but if there's again a big partial tear or there's kind of more extensive damage, again, PRP is not a cure-all. It's not, some people purport it to be just, truly the best thing for every indication. Come get your PRP and things like that. And, we do it mindfully and, considering the diagnosis and truly applying the best evidence-based, clinical decisions as we can.
Thanks, Dr. Berns. And Joe, this is where the market gets a little confusing.
We see a lot of different clinics, different healthcare companies promoting, regenerative medicine, PRP, orthobiologics directly to customers. And, like Dr. Berns said, the treatments can be purported to this be replacements for other care, replacements, a one-for-one replacement for surgery. And that's just not the case. It's, appropriate for certain patients with certain conditions at certain times, and then it's not in other situations. So that expectation of regenerative medicine, we talked about how that's problematic, and or that it's a cure-all for everything is really problematic and can create unrealistic expectations for our patients.
Yeah, I mean, I think you kind of hit the nail on the head. I think, some of this is very confusing. I sometimes almost feel bad that, sometimes, again, the claims are going around on the internet, on the radio. People even bring us information where, they went to this clinic or they have this information about prices and what the injections are. And is it PRP? Is it saline? Is it stem cells? So it gets very confusing. And, sometimes even the more confusing thing is the prices, the costs. People are, sometimes paying I mean, I don't want to quote everyone, but sometimes it's $2,000, $3,000, $5,000 for a shot of injections or a series of injections. And, that to me is bad almost because there's no information going around that we need to kind of cut through that. And a lot of times it's, me sitting down with the patient and talking about, what we have to offer. And, I think we can share some costs that we have, but, truly for one site or one location, ours is $650. If we're doing bilateral, it's $750. And really those prices are just to cover our costs and some of the supplies that it takes to do it in the office. We're really trying to not incur extra costs to the patient. So I think we'll get into some of those things a little bit later, but I sometimes do feel it's very confusing, sometimes misleading. And ultimately it's, doing it for the right patient, for the right reason at the right time. I think it really has to make sense for everyone there.
I think so. And then, Joe, everything starts basically first with the diagnosis, right? I mean, you got to.
Yeah, I mean, it's really hard to, have this blanket, strategy of anybody that comes in is appropriate for orthobiologics. It's just not true. So, I mean, ideally to determine what the best treatment strategy is, whether it is orthobiologics, whether it's actually self-management in time, or, having a surgical referral is appropriate, we really need to do a comprehensive orthopedic evaluation and understand actually what's causing the problem. That's really what's really important early on.
Mm-hmm. I think you've got a good analogy for that, don't you, Joe?
Yeah, most of us, I would say probably all of us, drive automobiles. When you get a squeak in your car, it's a lot of like taking that car to the mechanic. A good mechanic is actually going to run diagnostics. They're going to actually figure out what's going on before they start just fixing things, and they could recommend a simple adjustment, or it might be a more extensive new part or a repair. And orthobiologics are similar that way. They're one tool in the toolbox, but they're not the solution for every problem that we see.
So going back to you, Dr. Berns, so once that diagnosis is made, how do you decide, where a treatment like orthobiologics then fits into that overall care plan?
Yeah, that's a really good question. So ultimately, what it comes down to is, again, we've made the diagnosis. So let's just say we're dealing with, some rotator cuff tendonitis or like tennis elbow lateral epicondylitis. It depends on kind of where they are, what their symptoms are, what they've been dealing with, or, how long it's been there. But a lot of times there's a role for, again, here shows some of the physical therapy, activity modifications. Is there ongoing overuse? Do we need to get medication on board to kind of help in the short term and allow that physical therapy to be most effective? So for some people, it's starting as simple as that. Other people are ready to start thinking about, do we need an MRI? Exactly what's going on. Did they have an injury where we need to consider a big tear or surgery? Or again, so then if we step back and think about, those patients that just aren't making progress with some of the therapy, we do start thinking about injections, right? And again, it's not a one size fits all approach. So we often have to think about, have they had injections? Can we try a steroid? Are there other, do we do the PRP? Does it make sense for them and their diagnosis? So I know certainly is nuanced, but yeah, I do think there is kind of this continuum, and we always kind of start with the things that can be easiest, kind of most straightforward, hopefully the most cost effective for the patient. So again, once we get to talking about, PRP, we just have to make sure it makes sense, but it kind of comes in probably later in the process that most people think. It's not my initial first thought with every patient that walks in the door. It's, a tool in the tool belt that we can pull out if we really need it.
Nice. Joe, why don't you walk us through like a real world example?
Sure. So a patient that we see fairly often in the orthopedic clinic, let's say she's a 54-year-old woman that started to have knee pain, and her first initial knee pain was decades ago, 20 years ago. At that time, she was diagnosed with a meniscal tear, and she actually had arthroscopic surgery to address her meniscal tear that was followed up by physical therapy. Back then, she did really good. She recovered, she stayed active, and she was doing really well for many years, for decades. But what can often happen then is later on that pain can gradually return. And in this, example, the pain returned. And in the past couple of years, it became significant enough that she decided to seek medical care again.
So what does that next step process look like then?
Why don't you go to the next slide, Randy? But like many patients, she started with non-surgical treatments. She tried physical therapy and maybe even a cortisone injection to reduce inflammation of her knee. But unfortunately, those two things didn't get her where she wanted to be. She continued to have pain, and enough pain that was limiting her function and her, impacting her daily life. So at that point, she did follow. Then it would be appropriate for her to follow up with somebody like Dr. Berns for an orthopedic consultation and to have a more further evaluation.
Great.
Yeah,
And
if I can just jump in there for a second, I
You bet.
think a couple kind of important things to think about there. So this patient, had some intervention previously. She has gone on, maybe initially was doing well, but then ultimately got to a point where the pain was impacting her function. So, she's relatively young, right? So you're not immediately thinking about knee replacement in her, but she's done a lot of the things that we think about, right? So the physical therapy, medication, maybe again, she did try maybe the corticosteroid and might have been helpful for a short period, but again, like I think about it, it's kind of like a Band-Aid. Can we calm down the inflammation? And I've had people that do well for 3 months, 6 months, sometimes a year, but again, this is where it gets nuanced, right? And I think that PRP is just another tool in the tool belt for this knee patient or this, maybe that mild osteoarthritis where we're not quite yet ready to think about knee replacement. That's where kind of this PRP or orthobiologics kind of helps fill that gap of, what's best for that patient and helping to just improve their pain, improve their functioning. And a lot of people don't want a surgery, so keep them avoiding a surgery, both for the costs and the recovery and things like that. So I really truly think that this can be helpful for patients.
Absolutely. Well, let's bring it back to that employer perspective. We've been getting some questions on this. That's why we actually put this program together today. So, Joe, why are organizations interested in exploring more about this?
Employers are always looking for ways to support their employees with their health care, and things like musculoskeletal conditions. And this is a way for us to potentially help manage healthcare costs and improve productivity by having additional treatment options that actually can help patients feel better and extend their care and their healthcare life, so to speak.
Yeah, and I just really truly, I know we talked about it a lot, but it is helpful. So I think, we want our patients to stay active, stay healthy, return to work sooner, and just avoid surgeries if we can.
Really, the key here is really being having employers empower employees, but then also being informed on those decisions too.
Absolutely. It's about getting the right care to the right patient at the right time.
Yeah, thanks. All right. So in wrapping up today, any last thoughts, Joe or Dr. Berns?
Joe?
No, we have lots of options. Reach out to our business healthcare team. This is something that we're excited to talk about and really trying to present in a very responsible way. As Randy had indicated, we're not trying to bring this forward as a big marketing ploy. It's more about this is what we do day in and day out, and how we try to implement it in the overall orthopedic care that we provide.
Yeah. So really our goal is to take that clinical expertise, the evidence-informed treatment decision making, and really putting this into that full spectrum of orthopedic care to help support better outcomes for patients. So, if you're interested in learning more about this approach, you can definitely give us a call in business health and see how that could fit into a benefit package or the employer or your wellness strategy. So again, thank you for joining us, taking some time today. Thank you, Dr. Berns. Thank you, Joe, for coming on board and sharing this new information. Appreciate it.
Yep. I mean, I'm always happy to help. I certainly think that this has been helpful. But if we had more time, we could talk more and, ongoing conversation. So if there's ever any questions, don't hesitate to reach out here.
Excellent.
Everybody for your time.
Yep. Take care. Have a great afternoon. Thanks.